Hi, today we're going to talk about the 5 different signs you might come in contact with when you enter a patient's room. Our first one is the bear trap program sign. This sign indicates that you're going to have a high fall risk on your patient. You're going to need to stay very close to them when you walk with them, or you might have to move them from their bed to the stretcher. This sign is usually always yellow when you enter the room. Our next sign is going to be the contact sign. This is the most common one you'll see on the door. This is just a broad generalization that tells you a patient has an infection. This sign indicates you're going to need to use hand sanitizer, wear gloves, and have a gown on. There's check marks beside each one showing that you need to wear these, and you're going to need to take your gloves and your gown off before you leave the room. Our next sign is the contact enteric sign. On this one, it's no different from the contact except that you have to wash your hands. You cannot use just hand sanitizer. You also need to wear gloves and a gown and take both of those off before you leave the room. Our next sign is the drop-up precautions. This patient has an infection in their lungs or their sinuses, and if they sneeze or get anything on you, then you could get infected. For this patient, you're going to need to wash your hands and wear a mask. And when you take your patient down the hallway, they're also going to need to wear a mask. And make sure you take yours off before you leave the room. Our last one is airborne precautions. On this one, you're going to need to wash your hands and wear a mask. This patient is also going to need to wear a mask when they're transported, and anything you breathe in from them, you could get infected with, so make sure you're careful with them.